It's my proud privilege as Secretary General of CAHO to welcome all of you to this session, and we have participants from over 27 countries joining us today. And I especially welcome our partner from Nepal, Kathmandu Medical College, who's joining us today for the first time, Mr. Netra Bandhu and his team. And thank you so much for taking your time and joining us. This is a privilege for us to be hosting our Centers for Quality Promotion as well. To talk a little bit about CAHO. CAHO is the consortium of accredited healthcare organizations in India. We were established in 2013, and we are established to promote quality, patient safety, and accreditation in the country and the region. And we have with us today the patron of CAHO, Dr. Nagendraswamy, who's going to be moderating the session. Thank you so much, sir, for taking the time to be moderating this session today. And Dr. Nagendraswamy currently holds the position as President, MS Ramaya Medical Memorial Hospital, Bengaluru. He has over 38 or over 40 years of experience in healthcare management with various national and international organizations in very senior managerial positions and board positions, and has proved his expertise across the healthcare industry. So he's going to be moderating the session, The New Path to Excellence. I hand over to Dr. Nagendraswamy to introduce Dr. Leslee J. Thompson. Dr. Leslee, we have a very interesting connect. I worked as a teaching assistant at the Rotman School of Management under Sergio Meza in Toronto. And when I saw your profile, I was delighted. And thank you so much for taking your time and for joining us today. Over to you, Dr. Nagendraswamy, to take over the session.
Thank you. Thank you, Lalu, for your kind words. Unfortunately, I would request you to introduce Leslee, but I would like to welcome the entire gamut of attendees today. I can see a very big contingents of 25 different countries. Nearly 27 countries are participating in this 44th session of the quality, which has started from CAHO and ISQua together. And Dr. Leslee Thompson, a CEO of Health Standards Organization Accreditation of Canada, is among us today. She is the Executive Director in Rotman School of Management, University, Toronto. That is the credential. She is the one who is going to talk to us today, and the new path to excellence is the quality. I'm sure there is no doubt in anybody's mind that quality is the mantra for the future, and quality is here to stay. CAHO has continuously trying, and we are continuously establishing our quality presence, not only in India, also across the globe. It is our wish that international ISQua and also people from other accreditations of the world should participate and give their inputs. And I welcome Dr. Leslee to this symposium, and I want her to carry on with this new path to excellence, the quality. And we have a last 10 to 15 minutes question and answer. I request everybody to write their questions in the chat box so that officials can take and bring this out. And on behalf of CAHO, as a patron and the organizing committee, I welcome one and all, especially the galaxy of the people from different countries. I can see some of my friends from Pakistan, some from Kathmandu, some very, very eminent people are here. And thank you very much. Over to you, because we are running short of the time now. Thank you.
Very much, everybody. If you take a good look at this picture on the slide, you will see a patient at the center, and that is Heather, one of our amazing patient surveyors at Accreditation Canada. Heather was part of the survey team at Trillium Health Partners in Mississauga, Ontario, when she got ill and had to return home. But the team was absolutely determined not to miss out on her expert knowledge, and Heather wanted to continue, so they rapidly co-created a way forward. They beamed her in on an iPad, put it on a stand, and wheeled her around to meet with other patients, community members, and professional staff, all ensuring that the voice of the expertise of the patient could continue to influence and enhance this very people-centered survey process. This story puts a spotlight on the power of people coming together to solve problems, to ensure all voices are heard, and to learn from each other to make things better for everyone. Leaving no one behind, it really breathes in new life into the science and theory of quality improvement by making it personal. The future of quality is all about people power, and this takes us beyond traditional approaches and methods, even beyond the quintuple aim. It requires us to look at every issue through a human-centric or people-focused lens. And if we are going to be able to solve the massive challenges ahead of us in healthcare and society at large, new ways of conceptualizing what excellence means are needed, and new ways about thinking about what success looks like are required and essential. So what does this mean for us and as leaders? It means it's time for Quality 5.0. And I'm excited to be with you today to share some thoughts on what that future of quality can look like and why it matters. And I'll give you some examples of work in progress, ideas on where we need to go, and with hopes that this will stimulate some ideas and actions in your own local communities. Just make sure. Oops. There we go. Looking back at history, industry revolutions have ushered in powerful forces of change in our society. And it's interesting to look at ways our approaches to quality have actually mirrored those. From manufacturing, mass production, and automation, we've seen the focus on productivity, root cause analysis, and lean methodology. The fourth industrial revolution is underway with its focus on data and technology. We're seeing accelerated use of big data, smart systems, and virtualization, AI, and the Internet of Things. And these are already having a profound impact on the way in which we plan and deliver healthcare services. In fact, the time span between these revolution eras is getting shorter. Post-pandemic, many of these digital forces went into overdrive and have already signs of the next revolution have already emerged. The notion of Industry 5.0 is a relatively new concept. It was introduced at Davos at the World Economic Forum in 2021, where innovation continues, but at the same time, the value to society from all industries increases dramatically. Industry 5.0 will be the era of personalization, where every individual matters and where value is defined more in comprehensive societal terms. In a paper on Industry 5.0 published by the European Commission, it calls for innovation agenda that tackles big societal issues in a way that is human-centric, resilient, and sustainable. We've been talking about this kind of agenda for change in healthcare for a while. What makes this particular point in time exciting, however, is the alignment across sectors and the momentum that it is building. We know how hard it is to drive change of this magnitude, and navigating through this era won't be easy by any means, but it does feel like Quality 5.0. The time is now, and it's up to us to make it happen. It's always important to start with your why, and knowing your why is key to getting started and on track, especially when the road gets bumpy, which it always does. At Health Standards Organization and Accreditation Canada, we know our why. Our reason for being is to empower and enable people around the world to continuously improve quality of care so that together we can achieve our vision for safer care and a healthier world. When we talk about safety, it's about physical, psychological, and cultural safety. And thinking about our role of contributing and making the world a better place puts us in a bigger context than in ourselves. We're confident that in this vision because there were thousands of voices that helped shape it. So it's not just ours, it's a shared vision with others. At HSO and Accreditation Canada, we work across over 12,000 locations in 40 countries, over 5 continents. And Together, we touch over 50 million lives. With our partners, we know that our reach and impact will continue to grow. But as the saying goes, what got us here won't get us there into the future, especially when you factor in the dynamics that we've all experienced during and post the global pandemic. Everything has changed. How we think about quality, how we think about excellence, and what this all means for standards and accreditation bodies going forward. We need to be relevant and need to be focused on issues that matter to people today and help prepare people to handle the issues of tomorrow. In my recent article on the concept of Quality 5.0, published in Longwoods, and I've got a little QR code at the end that you can have, I take a deep dive into the big issues facing healthcare leaders today, and I'm going to share 5 of those with you now. Starting with one of the most profound issues facing every country and system around the world, and that is the workforce crisis. There is no quality without a healthy and competent workforce. And in 2009, the WHO described the serious workforce shortage as one of the most critical constraints in the achievement of health and social development goals. Fast forward into 2024, and we're suffering the consequences of inaction, of failed strategies, and short-sighted solutions. And then there were the compounding effects of COVID. Workforce retention rates have worsened. Medical leaves, mental health struggles, and even suicide rates among healthcare providers have increased. And the next wave of crisis is right around the corner, with worldwide shortages cited at 18 million healthcare workers by 2030. To say this is a challenging problem to solve is an understatement, and it's easy to be discouraged, but sitting on the sidelines or assigning blame is not an option. So there are a few pivotal points to think about and understand related to this crisis and what it means for quality. First, the crisis of workforce is global. And while we need local solutions that fit context and capabilities of every single country, we can't be reinventing the wheel at every turn. We have to scale leading practices and fast. The sheer number, size, and severity and complexity of the problems mean old solutions are not fit for purpose, and public trust in our ability to support needs of healthcare workers is in decline in many countries, and this is something that needs to be earned again if we're going to move forward. And facing facts means having access to data that's timely, that's relevant, and comparable. Without that data, we're working in a vacuum and we will repeat historic mistakes. HSO has taken the step to increase our understanding of the ways in which the workforce well-being intersects with safety culture, so that people can be armed with actionable insights that help drive much needed change. And this is a unique combination of evidence that can emerge from this type of survey. The rigorous evidence-based methodology has been used to design and test this new tool that is being rolled out across every part of the healthcare ecosystem and sector across Canada and internationally. As the first of its kind, we're already finding ways in which healthcare workers are having a voice on issues that matter to them, that influence their ability to provide safe, high-quality care, and that really zero in on the conditions of quality that can support and enable high-quality care. And when you think about participation rates using this tool, being able to grow higher and being able to benchmark, it really can provide a fantastic platform for change. And that's why we're inviting organizations like any of you who are out there to be able to use the tool and to contribute to this global benchmarking index. And that will give us a robust inventory of leading practices and solutions. When we tested the new approach with over 10,000 people across multiple settings in hospitals, long-term care, community care, the themes that came out were very common across settings, and we know these resonate across countries as well. burnout, not having enough time to do what's expected in your job, and lack of positive recognition with work environments that are not deemed to be safe. These are essential problems to solve if we are going to tackle and position quality in a new way in the future. This is just one example of a slide of the kind of data that can emerge when we think about the impact of leadership on culture and safety culture, and providing safe conditions for care is an essential ingredient in terms of quality. And thinking about how that really matters to the people that are in the workforce is key. And these kinds of insights, combined with various data points like tenure, job category, demographics, type of setting, incident reporting, and even adverse event reports, can provide foundation for a powerful dialogue with the workforce about what needs to change. I'm excited about working with organizations to build new data perspectives to bear so we can tackle this multifaceted challenge. It's not going to be easy, but we need to strengthen the ability to have much more precise insights and actionable insights that can prepare us for the future. Because it's not whether, it's when the next crisis will occur, and we need to be ready and ensure our people feel ready and supported. Addressing inequity is a universal imperative, and so many challenges were exposed when we all experienced the global pandemic. Barriers to equity are high, and the consequences of inaction are profound. Equity is about fairness, about freedom from racism and discrimination of all kinds, and it's intimately tied to quality and safety. At HSO, we've been spending the past few years learning and unlearning ways to address Indigenous-specific racism, and we've been co-creating conditions that foster cultural safety wherever people receive their healthcare services. Cultural safety is now embedded in the way in which we think and act about safety. It's an essential dimension. It's a theme that's being embedded in our standards and safety practices. And give you an example of some of the things that we've learned along the way by embedding equity as a foundation to the quality. The BC Cultural Safety and Humility Standard is a groundbreaking, not only in its content, but in the process that was used to bring it to life. Over a 3-year period, a 16-member Indigenous-led technical committee met to shape a standard that, when adopted across the country, will change how Indigenous people experience care. We partnered with First Nations Health Authority and with others to learn and unlearn about how to bring Indigenous knowledge and experience into the standards development process. And to make sure this isn't a one-off, we are embedding an equity lens and new language in our standards, including the voice of vulnerable populations in how we design our standards and deliver new programs. Be it people within our corrections systems, in jails, people living with mental health and addictions challenges, or people living in very remote rural communities. We're striving to make those who are usually invisible visible when it comes to influencing the future of quality. And the richness of the voice and the perspective is profound. Once you start down this path and increase the participation of patients, families, and citizens in that design and delivery in very meaningful ways, you will never be able to return to the old ways. It's all about making healthcare truly personal and reflecting people in the process. This experience has forever changed the way we work and approach issues at HSO, and we're living declarations of commitment and actions plans with initiatives that apply to multiple populations. So when you think about this example of addressing inequity with Indigenous population, as I've described here, the same principles apply to others as well. The next big and massive challenge that are facing the healthcare systems and society and healthcare leaders at large is the climate crisis. It is unlike anything we have faced before. The WHO called the climate crisis the greatest global health threat facing the world in the 21st century. It affects everyone, but not equally. Some people are more at risk than others because of age, genetics, social economic status, where you live, where you work and play. Between 2030 and 2050, climate change is expected to cause over 250,000 additional deaths per year. That's 5 million people losing their lives in that period. And when we consider that the healthcare industry is one of the top contributors to global net emissions and other sources of environmental harm, the urgency and the responsibility to act is high. Like other challenges we've identified, solutions are not simple, and change needs to happen at multiple levels, including government and policies and multinational initiatives. I really feel that we're fortunate to have leadership from groups like the Geneva Sustainability Center that offer terrific resources for hospitals and accrediting bodies. At the ISQua Accreditation Council, we've been talking about ways that we can come together, even as organizations, on how to drive change and impact together collectively. I'm pleased to see climate action and sustainability as themes at almost every conference across sectors, including healthcare, and there's lots of opportunities for global exchange in these forums and elsewhere. Sustainability is increasingly considered a dimension of quality. And while that is a whole separate talk, HSO and Accreditation Canada, we're taking a very comprehensive and coordinated and cohesive climate action strategy that is being shaped with our many clients and partners. We know that there are many players across industries that need to work together, and our goal is to ensure that we use our specific levers for change in very responsible, proactive, and high impact ways. And it's up to each and every one of us as citizens to do our part to effectively protect our planet, respond effectively to crises when they occur, and support people in their communities. In talking with the healthcare leader recently, she said, never in my wildest dreams did I realize that one of the most important jobs I had was to be able to handle and mobilize the community in response to fires, floods, and other natural disasters. But this is an increasingly common scenario. Fragmentation is the next big challenge we are facing in addressing a high quality and excellent care system. Fragmentation can result in medication errors, unnecessary medical visits and procedures, avoidable admissions, lack of access at all to necessary care, and even death. Harm happens frequently at care transitions. It's one of the times where harm happens most, with breakdowns of communication between providers and between patients and providers. This is a serious high-risk area for people living with chronic illness. Fragmentation exposes gaps and cracks in every fabric of our health and social care systems, especially with vulnerable populations who would not otherwise access the system at all, or if they do, only when in crisis. So what does a people-centered connected care system look like, and how do we build it? Our expert global committee that helped over 3 years ago develop the new people-centered integrated care standard that is available nationally and internationally, came together and looked at all the best practices in the world, the latest research, and a consensus-driven process that came with 10 design principles that really seem to resonate with people around essential ingredients for people-centered integrated care systems. Everything from the steps you take to define populations and outcomes, having comprehensive and coordinated continuum of programs and services, to seamless access, flow, and transitions, system leadership, to even the policy pieces of interoperable information systems, and aligned funding and incentives. These are only like big ideas in some societies, and not everybody is at the same stage, but this gives a marker of what excellence and opportunity for fully people-centered integrated care systems can look like. And by implementing, then designing our tools and resources and quality initiatives around these principles, we have the opportunity to improve quality in some very significant ways. At Accreditation Canada and HSO, these are some examples that I wanted to share of things that we're doing right now today to help advance integrated care and what that approach looks like. These examples may stimulate ideas for you in your own organizations and systems. The first is we conduct surveys, often our accreditation surveys, across sectors, not only with hospitals, but bringing together hospitals, primary care, long-term care, community care that are serving the needs of common populations and undergoing that accreditation process together with a shared accountability for improving the health and well-being of that population. Standards that our language and standards forge system connections as expectations. So you're always looking at the parts and the way things come together. We also assess cross-patient pathways and some in the whole province of looking at young people with mental health and addictions challenges as an example, and tracing, the concept of tracers, but think about tracers not within organizations, but across that experience of care for the patients. It opens up a whole new way of looking at the design and delivery of quality across sectors to improve quality across the lifespan of the individual. Fostering team-based care models in primary care, home care, virtual community, integrating new criteria that forge the building blocks for integrated care are now part of accreditation programs, and assessments of how people are progressing in that integrated care journey, the maturity, because it is a journey for hospitals, health systems, and networks to achieve. So these are some examples of actions that can be taken to advance that excellence in integrated care that are shaping new ways of thinking about how we deliver high quality care at all levels. The next most significant, one of the most significant challenges that we're all facing in the healthcare sector that has far-reaching implications is about avoidable harm. We all know the rates of harm in hospitals and other parts of the healthcare system around the world have increased post-COVID. And exposing that and dealing with the realities of that is essential for us. 1 in 17 hospital stays in Canada involved at least one harmful event in the past year, with 50% of those from healthcare and medication procedures, 30% from infections, 18% from procedure-related and other patient accidents like falls. The pattern is similar to what's reported in other countries. Harm in other parts of the healthcare system is not as well documented, but we know it's increasing from various reports. We have pretty good data, lots of knowledge and safety practices, standards, regulations, and policies, and external evaluations. So why is harm increasing? How do we make sure that it's put back on the front burner and supported and enabled to achieve the changes that our system and patients deserve? Over time, we have evolved through approaches knowing as with safety 1, focusing on what's wrong, safety 2, focusing on what's going right. And I've just read about the evolution of a safety 3 concept, which brings a systems approach to design of safety practices. And I think that makes sense. And it puts harm in a much bigger context. And that those solutions need to then move beyond checklists and static protocols and address human factors, adaptability, culture, and resilience. We know it's time to put safety back on the front burner, and that's an essential piece of work that we need to do together with new methods and new ways of ensuring that evidence is brought forward in timely and effective ways. Avoidable harm is also the theme we know in the Global Patient Safety Action Plan. I just am so impressed by the way in which this plan is mobilizing action across nations and at the very micro level at individual plans and delivery organizations. I've attended the Ministerial Summit a couple of times now with people from around the world coming together around these common goals, and it sets out some very practical and probable solutions for making an impact. And again, this is another way in which we need to be coming together at all levels to improve outcomes. Each one of the big challenges that I've just identified, they require us to work simultaneously across individual organizations, regions and networks, and health systems and government level. And it's only through that multifaceted approach that we are going to be able to make a difference. So what are the shifts that are required if we go down as we move into this path and move into the era of Quality 5.0? We need to move from silos to systems thinking. We need to move from the focus on places and buildings, populations that we serve, from technology to transformation of care models that really can unlock some potential of new ways of working and thinking about the design and delivery of services in a much different way. We have to think of moving beyond collaboration and go to true co-creation. This is hard work, and it requires new skills and capabilities from all of us as leaders, but it is the way forward to unlock the potential of this next era of quality. And finally, this shift in our mindset and our practices from healthcare to health, and focusing on that health for all. So what does the impact of Quality 5.0 look like? Well, there are some new indicators, some ways of thinking about the framework of Quality 5.0 that really resonate with me and I think lay out an agenda for change. The first is around social participation, and the recent UN Declaration on Social Participation is a phenomenal opportunity and platform for change that each of us have a responsibility to embrace and foster within our own local communities. The more active people are as patients, families, and citizens in tackling these big challenges that I've just outlined, the more opportunity we have for success and change. Resilience is a new dimension of quality and really helping to prepare us for more effectively for the future, for preventing and protecting ourselves from new and inevitable challenges and crises. Sustainability I've spoken about, which is really about being ready for the long term, and the sustainability efforts, be it the long-term initiatives associated with climate change to really robust practices within organizations that bring long-term sustainable health. Trust needs to be re-earned and regained, and I think it's central to the quality agenda going forward. It needs to be looked at as a very specific indicator unto itself. And then there's prosperity, which goes beyond the economic success and affordability. But prosperity is where everyone has the opportunity to thrive. And the impact of quality and the engagement of people, citizens and people in addressing the big challenges that I've identified creates new opportunities for thinking about prosperity and health and well-being. All of that tied to the attributes of learning health systems, where we're constantly putting new evidence into practice, learning from that, and rapidly continuing to improve. At the end of the day, that's all about leadership. And these changes that I've outlined in Quality 5.0, the new era that we are moving toward our ability as leaders to lead in new and different ways is really going to be challenged. But we need to think about unlocking that power and potential of people around us as they contribute to this agenda for change and build new ways of thinking about strengthening our own abilities. Once you start down the path of engagement in a different way, thinking about quality beyond some of the technical and tactical initiatives and thinking about the big societal problems that also we need to solve, your whole frame of reference of what it means to be a leader will change. As the expert and admired leader Don Berwick once said, well, recently said, you know, as healthcare leaders, we know you're working. We know you're working hard. We know you're busy, but you do not get a pass on addressing these big societal issues. This is the new work. This is the new work of leadership. So in this era of Quality 5.0, it is all about people power. And when you think about channeling that people power toward the goals of improving quality, health, and well-being, the whole notion of people-powered health comes alive. So I leave you with the question of Quality 5.0, are you ready as a leader? Together, I think we've got lots to learn. We've got a lot of room to grow. And there's an imperative that's right on us today to be well prepared and embrace the challenges that are here. And I hope that the focus of the new era of Quality 5.0 brings some new perspective, some questions, some ideas, and some challenges back to me and others who are looking at the future in some new and different ways. I look forward to your questions, and I wish you well in your own journey toward leaders in this new era of Quality 5.0. Thank you.
Thank you, Dr. Leslee Thompson. Wonderful introduction to the Quality 5. Now, my dear friends, it's time for me to really introduce her because I wanted the maximum number of people to be around. We have now nearly 400 participants on the line. Dr. Leslee Thompson is a leader in quality. She is the CEO of the Healthcare Standard Organization and Accreditations of Canada. She has been involved in improving the quality in over 12,500 locations, 40 countries, and 5 continents. I don't think she is an epitome of driving quality. And today, she has really touched upon very important new thinking, new ways of thinking to the quality with a Quality 5. Though she started her journey as a ICU nurse and reached CEO of many, many important hospitals and health systems. And recently, she has been awarded as 100 most powerful women in Canada. And she has also received a prestigious legacy of leadership. Madam, it's well accepted, and you are the most deserving candidate to receive these things. And we from CAHO are really appreciate your participation through ISQua, and you have been on the board of ISQua for some time. This is a wonderful opportunity for all of us at CAHO to listen to this new way of thinking, especially the 10 design principles that you said, the more of the challenges that you said, where we don't consider in an immediate quality, what is inequality, climate crisis are very important issues that you brought out. The most thing that I liked is the shift in the leadership thinking, from silos to systems, from places to population, from technology to transformation, from collaboration to co-creation, from healthcare to health. Wonderful ideas, and I'm sure there will be quite a few interesting questions, and so many global leaders today, more than 25 different country people are have listened to this wonderful talk. I once again thank you for this beautiful talk and informative talk. Over to the questions, please. Thank you.
Yeah, thank you. Thank you so much, Dr. Leslee. I think there are a couple of questions and amazing session, I must say. So from Sheikh Fateh, I'm so sorry, Pat Chame, your concepts relating to Quality 5 about Canadian system of healthcare. Can you explain, is it possible to apply your concepts in the case of developing and underdeveloped countries? What do you say, Dr. Leslee?
Oh, thank you very much. The concept of Quality 5.0 is absolutely a global concept. It is, I've given some examples of where we have been taking action in relation to each of the big challenges. But these are absolutely, this is a global shift. The whole notion of industry revolutions is global. The notion of Industry 5.0 was introduced at Davos at the World Economic Forum and is the way in which it's starting to shift to talk about changes throughout the world. I think there's a lot of very important relevance in every country and type of circumstance. With when you ask about underdeveloped countries, absolutely the workforce crisis manifests itself in very profound ways. And the same with inequity, with climate change, with the focus on with the challenges related to avoidable harm, and the big fragmentation of care and the access to quality care. So Quality 5.0 is absolutely a global construct, and one that can really unite us, because it's and the types of impact that I described, of the notions of trust and resilience and sustainability and social participation also transcend geographies and economic conditions, so that they are goals and aspirations that we can all mobilize around. Some of the actions you might take would be different depending on depending on the environment, but all of the examples and framework that I present today are built from the knowledge, the wisdom, and the opportunities that exist across the entire world.
That's amazing. And the next question is also related to what you said, Dr. Leslee. How do you implement in a country where quality is a new field of practice? The first was, can we? And now, how do we? This is from Dr. Mirza Athar Ali.
Well, I think this is where everybody is at different stages. And so this is one of the really most important recognitions of the fact that quality is a journey, and it is a kind of a dynamic concept. And that's why I'm so, the notion of Quality 5.0 resonates so much with me and with others that I'm in when I talk in countries that are at very, very early stages of thinking about quality and building the quality systems within their countries and organizations. I think this is why, if we orient ourselves to quality in this way of making it very personable, adaptable, and having people as the power for making change, it does enable us to move in different ways. It's not about a one-size-fits-all. It's not about prescriptive. It's not about holding the bar so high that it takes you 10 years to achieve it. It's about putting those milestones in place, part of the continuous improvement and learning journey, to address the issues that matter to the health and well-being of the people within your own local community. The solutions you put in place or it might be the first time or the early stages of addressing quality, may be quite different than at a very, sophisticated or traditionally sophisticated high, system in another part of the world. But it's no less meaningful. And these new ways of thinking about the people providing care, how you involve and engage citizens in coming up with ideas that make a difference in their lives to help people thrive and to enable your community to be more resilient and sustainable practices, all are part of that early journey. But that's where leadership comes in around sharing practices, sharing ideas, helping people not reinvent the wheel, so that as you're starting that journey and taking very small steps, but deliberate steps together with your communities, you are going to be in a position, and we can together support each other, lift each other up, and progress. That's why we love working at HSO and Accreditation Canada. We love working in communities that are in those very, very early stages, because actually you discover some incredible ways of moving forward that actually have a lot of lessons to those communities and organizations that have been traditionally more focused on some of the traditional methods of quality. But these new methods are new to all of us. So we're actually all starting a new journey together.
Thank you. Thank you so much, both Dr. Nagendraswamy and Dr. Leslee, for the amazing session. I want to take this opportunity to thank everybody. Dear participants, many of you have requested for the presentation done by Dr. Leslee. If I may take her permission, if it's okay with her, can we share the presentation as a PDF to all our participants who have joined us today, Dr. Leslee?
Yes, and we'll make sure that you've got the latest version of that, and so that can go out. And happy to talk with people and follow up conversations, hear your ideas and what your thoughts are to keep this conversation going. That's the way we're all going to continue to learn and inspire each other to engage in the future to make Quality 5.0 a reality.
Absolutely. Thank you so much. May I request the CAHO team to kindly put up the certificate of appreciation from our side to Dr. Leslee, please. And I would request Dr. Nagendraswamy. Dr. Leslee, you may want to unshare your screen so that our team starts sharing. Dear participants, you will receive the certificate of participation with the credit hours from CAHO if you are available for the entire session. Just bear with us for the next 5 minutes. And I would request Dr. Nagendraswamy to kindly present this token of our appreciation to Dr. Leslee for sharing her valuable inputs, please.
Dr. Leslee, it's an immense honor and proud privilege of me to give this certificate of appreciation on behalf of CAHO and ISQua. And we are really, really happy that the new thinking is very, very important. You have rightfully started the journey, and we will continue this conversation. I think CAHO on its own now will take this initiative. CAHO will introduce many of the concepts that you have shared in Quality 5.0. We, from this country and to this part of the world, we will definitely take it around. Thank you very much. Please accept this token of certification of appreciation from our side. Thank you very much.
Thank you. Thank you, Dr. Leslee.
Thank you so much.
You may want to go through the comments, the webinar chat and all. Plenty of thank you and appreciation to you for the presentation. Thank you so much for joining us today. Block the date for the 45th International Webinar Series. And once again, thank you so much, Dr. Leslee, for your time and for the session.
Dr. Leslee, on behalf of the CAHO, I'm formally inviting you, if you could join us for CAHOCon 2025. It will be nice. We have an international wing. Having you there will be a wonderful opportunity for our members to share your knowledge in CAHOCon. I'm sure Lalu will send you the official invite to join us.